Hi everyone, today we're going to be talking about the pelvis, specifically some of the somatic structures, the skeletal muscles that make up the pelvis and the weird, odd planes of fascia and spaces that come into existence accordingly. So we'll be looking at the deep pelvis, shown here from above, as well as the, shall we call it the undercarriage of the pelvis, the perineum. So the anal region, anal triangle, and the urogenital triangle, and look at some of the structures that are visible there. Now before we go forward with that, let's review real quickly the actual structures that make up the pelvis. The bones, we've got right here, making sort of a V, the pubic bone, contributing to the acetabulum, where we articulate with the femur. Up here, we've got the pubic tubercle and the pubic symphysis, where it meets its counterpart on the other side. Pubis continues inferiorly. It's the inferior pubic ramus. Here's the superior one. And the inferior pubic ramus is what meets the next bone in the set, the ischium. Ischial tuberosity is this large structure right here. And then we've got the inferior, the ischiopubic ramus, and contributing to the acetabulum here as well. I'm going to show real quickly on the posterior side, we not only have the ischial tuberosity, but we've also got a little strut right here called the ischial spine. Let me see if I can get a nicer view of that for you. So the ischial spine is a little strut of bone sticking up posteriorly and makes a little notch here, the greater sciatic notch and the lesser sciatic notch. Now both the ilium here, the larger bone, the pubis, and the ischium all contribute to the acetabulum, this ball and socket joint. And the ilium, the last bone in this set, is really the most extensive. It's got a very broad iliac crest for muscle attachment. We look at it on the inside, or the inner view of it. We've got an ilial surface for the iliacus muscle, and also contributes the auricular surface that articulates with the sacrum. 5 fused vertebrae making up nearly the end of the vertebral column, and then the coccygeal bones right at the bottom there. Alright, so we've covered the bony features here. Let's get started and look at some of the soft tissue structures in this really challenging to visualize area. Now that we've covered the basic bony anatomy related to the pelvis, we're going to move on to one of the stranger muscle groups that is actually involved in pelvic activity. And the muscle group as a whole I've shown here in black and white construction paper. Now this group of muscles in black and white is referred to as the pelvic diaphragm. In a lot of illustrations it's actually shown as though it's very flat, but it's really very funnel shaped, going down the pelvis. And if I flip it over here, you can see it coming to a funnel just on the underside there, which we'll talk more about in a second. Now the pelvic diaphragm resists pressure from above, so if we have a Valsalva maneuver where we hold our breath and bear down, contract our muscles, these muscles also contract to keep the pelvic viscera inside the pelvic cavity. So they help push back up, hence pelvic diaphragm. It has 2 parts. In white, I've shown here, the part is referred to as the levator ani. Levator ani, which, no big surprise, lifts the anus as it's funnel shaped, and you notice there's a hole at the bottom of the funnel, and this is where the rectum terminates at the anus. And when this muscle contracts, it's going to elevate the anus, levator ani. In common parlance, we could call that pinching off. In black, we've got the coccygeus muscle. The coccygeus muscle is another part of the pelvic diaphragm, but it's not directly involved with lifting the anus. It also contributes to maintaining normal pressure as we bear down or pressures change, and it's coming from the ischial spine to the coccyx. Now the various portions of the levator ani, there's 3, all have one thing in common. They kind of come from an arched origin, and they actually originate, I'm going to tilt the pelvis a little bit here so we can see it, from part of the obturator internus muscle. Now I'm outlining the obturator foramen on the pelvis. Obturator foramen has a muscle sitting on the inside, roughly where my hand is, and has a muscle on the outside, roughly where my hand is. That's the obturator externus and the obturator internus. The obturator internus has a really thick medial wall. Its fascia of that medial wall is very thick because it actually serves as the origin for these levator ani muscles. So as it crosses this obturator foramen, this muscle actually has a pretty strong attachment to the fascia of the obturator internus muscle. Now, we're going to flip the pelvis here so we can look at it from an inferior view. And again, you'll notice that the levator ani is funnel shaped, leading to the anus, where we'd have the external anal sphincter right in this area. Even though it comes from the obturator membrane, there's three different parts of the levator ani that are named for the nearby bones. So as we move from pubic bone across to the ilium towards the ischium, we've got here, well, first off, there's the midline raphe, where these meet on the midline. In everyone, we have a urethral opening, and we'd have a vaginal opening in females. This area is referred to as the puborectalis. The portion just lateral to it is the pubococcygeus, for the obvious reason. It doesn't wrap around the rectum, it wraps to the coccyx. And then lateral to that, we've run out of pubis, we now have the iliococcygeus muscle coming back here to the distal sacrum and coccyx. Now in black, once again, here's another view of the coccygeus muscle, which is sometimes called the ischio-coccygeus muscle because it's coming from that ischial spine and traveling out to the coccyx and distal sacrum. Now, this creates an area between the ischium, here's the ischial tuberosities, and the levator ani. It's called the ischio-anal fossa. And like your body, or anyone's body, tends to do in places where there's space, your body packs a lot of adipose tissue and fat into that space. Now, this ischio-anal fossa doesn't only contain fat, although there's quite a bit of it there. It contains branches of the obturator, the pudendal nerve, which comes across from the greater sciatic foramen back in the lesser sciatic foramen, as well as the internal pudendal artery and vein, which have the same course. Now they're traveling in another fold of the obturator internus membrane. So it's actually, obturator internus membrane is doing double duty. It's origin for the levator ani. It also forms a canal known as Alcock's canal, or more appropriately, or pudendal canal, which allows the internal pudendal vessels and pudendal nerve to get all the way forward to reach the external genitalia in the perineum, which we'll talk about in just a bit. As that happens, it gives off branches to the levator ani, branches to the external anal sphincter. So you have external anal sphincter innervated by pudendal nerve and all of its branches. And then, if we put what's going to be a major topic in a moment, the perineal membrane onto this area, covering the urogenital triangle, the perineal nerve and internal pudendal branches will be innervating structures in this area. Now, one quick fact that's kind of fun, for me at least, is that the internal pudendal vessels and the pudendal nerve all travel through this area, innervating the anal region, and out here, the external genitalia. The translation of pudendum from the Latin is shameful, so it's the shameful nerve. It's all the stuff that we don't talk about, or at least we didn't talk about in polite company back when this stuff was named several hundred years ago. The last thing I want to show involving the levator ani and the pelvic diaphragm is we have this ischio-anal fossa that we've already shown between the ischium and the levator ani. But if I put the perineal membrane here and create the urogenital triangle, there's a space that's deep to that perineal membrane, but superficial to the levator ani. And that's an anterior recess of the ischio-anal fossa. So you have a potential, well, not potential, an actual space full of adipose tissue right here. And if you have infections in the perianal region, it can spread fairly far anteriorly through those anterior recesses, as well as set up abscesses in the ischio-anal fossa itself. Finished up with the ischio-anal fossa and the levator ani, pelvic diaphragm, and we're going to move to the perineum. Now, perineum is, for lack of a better phrase, the undercarriage of the human body. It's where the external genitalia are located, and the openings to the internal genitalia are. One of the common things that we're going to use to orient ourselves in this area is what's called the urogenital triangle. Starting from the pubic symphysis, we go down the inferior pubic ramus, across the ischiopubic ramus, and at the ischial tuberosity, we're just going to cross the midline to the opposite side, and the same structures on the left and right. So that is the UG, or urogenital triangle. I'm going to make a little version of it with my hand right there so you get the idea. Now this area is covered by a thick membrane of connective tissue called the perineal membrane. So perineum referring to this whole area. I'm going to show the male version first because the erectile masses of the external genitalia are a little larger, give you a sense of what's happening before we move to the female version. And you can tell this is the male version here because there's a single opening in the perineal membrane for the urethra. If it was female, we'd have a urethral and vaginal opening, and this membrane covers the area of the urogenital triangle. Now at the same time, we have muscles associated with this area, both urinary continence as well as some of the sexual activity and skeletal muscles involved there, all have to be originating in this area. So if I flip our perineal membrane over, you'll notice in pink here with the thermoplastic, I've sculpted some skeletal muscles. I've made them a little bit heftier than they actually ought to be. But this area in its entirety is referred to as the deep transverse perineal musculature. Now it's got a portion that wraps around the urethra and is referred to as the sphincter urethrae. And it's the deep transverse perineal muscle and sphincter urethra because if I put it back in position here, it's on the deep side of the perineal membrane. So I'm going to flip it one last time. Deep transverse perineal muscle with a subcomponent, the sphincter urethrae. And flip it back over. And at this point, we're going to put in place another muscle that's really pretty tiny, but is located on the posterior end of the urogenital triangle. And that's going to be the appropriately named superficial transverse perineal muscle. Now, if any of you have dissected this on a cadaver in your anatomy class, you will immediately note that I'm being extraordinarily generous with the size of this muscle. It's usually pretty wispy, but it's just covering the area of the posterior perineal membrane, that boundary there, urogenital triangle, going from ischium to ischium. And it's not the only structure that takes its origin from the perineal membrane. The erectile tissues of the genitalia do as well. So we'll start in blue here with one of the erectile tissues of the penis. This is the corpus cavernosum in blue. There's one on the left and one on the right. These two structures fill with blood during erection or engorgement and have the deep penile artery traveling within them that supplies that blood. They come together and to a variable degree fuse out here on the shaft of the penis. So that right there. And a lot of times this is referred to as the crus, so the crura of the penis, meaning that you have a bend. You have those two structures coming together. On the midline, we've got another erectile mass called the corpus spongiosum. I got here in purple. It's covering the urethral opening and runs up the ventral side of the penis and forms the glands. Now, the spongy urethra actually is within this entire structure, so I'm going to jab, ouch, a little opening for the urethra in the bulb of the penis, which is what this structure is sometimes referred to as. All part of the corpus spongiosum, rolls across the top, and kind of balloons or mushrooms out at the end to form the glands, or the head of the penis right there. So I've got those structures back where they belong. Alright, looks pretty good. So that is a nice representation of the erectile tissues of the penis in Play-Doh, or for those of you in the UK, plasticine. What we're going to do next is look at the fascia and other muscles that are located in this area. Over each of the corpus cavernosum as well as the corpus spongiosum, we've got what's called deep penile fascia that I'm going to show with aluminum foil right here. Deep penile fascia is relatively stout as it goes along the two corpus cavernosum, corpora cavernosum if you want to be particular about the plural there. And because it's relatively thick, when these structures engorge with blood, they tend to balloon outward, not out, but by elongating. So that's going to be responsible for the elongation of the penis during engorgement or erection. The deep penile fascia around the corpus spongiosum, in purple here, isn't quite as tough, and so instead of elongating, which it does a bit, it primarily gets kind of balloons outward and expands. So this deep penile fascia surrounds all of the erectile tissues individually and as it forms the shaft of the penis out here, fuses these tissues together to a greater or lesser degree. And this fascia will also sometimes be known as Buck's fascia. You'll sometimes hear it referred to as that. So Buck's or deep penile fascia covers these structures. Once knew somebody in graduate school named Buck I didn't really care for, so I always got a little chuckle out of that. Now on top of the deep penile fascia, we've got several muscles. These are skeletal muscle, so when they contract, they aid in ejaculation or the voiding of the bladder. On the two corpus cavernosum, covering the deep penile fascia, we've got two muscles. These are the ischiocavernosus muscles. And covering the bulb of the penis, corpus spongiosum, is a muscle, a little midline raphe that I've put in there, called the bulbospongiosus muscle. So, quick word on the terminology. If it's an erectile tissue, it ends with M. If it's a muscle, it ends with S. So the bulbospongiosus covers the the bulbospongiosus covers the corpus spongiosum. The ischiocavernosus muscle covers the corpus cavernosum. So you can do that in as annoying a Hermione Granger, Harry Potter voice as you wish, and wave your little pointer around as you do. But once again, ischiocavernosus, bulbospongiosus, covering respectively corpus cavernosum and corpus spongiosum. All right, now those muscles are sitting on top of the deep penile fascia, but we also have fascial layers covering these tissues as well. And we've got these in kind of cling film right here. If I lay this onto perineum, you'll see how this fascia forms a layer that covers these muscles and other nearby tissues. Actually, let's use a slightly larger one. Now this fascia extends posteriorly to the posterior end of the perineal membrane, wraps around all these erectile tissues and the muscles that are covering them, and this is the deep perineal fascia. Now one clinically important point about this that sometimes confuses people is that along its posterior end here, it is fused to the perineal membrane. What that means is trauma to structures in this area, like a straddle injury from someone falling off a bicycle and smashing their pelvis here, or rupturing their spongy urethra, having extravasation of urine and blood in this area, that urine and blood will fill this space right here, called the deep perineal space, that is deep to this deep perineal fascia. But that swelling, bleeding, and urine extravasation won't extend past the posterior border of the urogenital triangle right here. So the perineal membrane and the deep perineal fascia form a chamber in front that contains that fluid. Now, just mentioned a little earlier, we've got the deep perineal fascia, and below that, containing the erectile tissues and their muscles, is the deep perineal space, or pouch. We have a layer above that, and as the body likes to do, it's going to put some adipose tissue in between various layers. And the larger we are, the more adipose tissue our body cares to lay down. Or more accurately, the more adipose tissue we give it, the more adipose tissue the body holds on to. This fat is inside the superficial perineal space. Now if I were to then lay another layer of fascia down, if you've been paying attention, you probably won't be too surprised to know that this is called the superficial perineal fascia. And this creates a space containing that adipose tissue between the superficial perineal fascia and the deep perineal fascia. This space, indicated by yellow here, is the superficial perineal space or pouch. Then, because the body is cruel like that, we have the layer of subcutaneous fat. We'll put that in here. And since it's subcutaneous, the next thing above it is skin, which I'm going to show by laying down right here. I had my choice of white, yellow, red, brown, black paper, and I decided not to be controversial and just make our skin blue. So this is a nice illustration of the Smurf perineum right here. So that takes us all the way to the outside and the complicated structures of the perineum. To review, let's go from outside to in and review one last time. From the outside in, we have skin, subcutaneous fat, superficial perineal fascia, the superficial perineal space containing adipose tissue to a greater or lesser degree, the deep perineal fascia, which is also within the superficial perineal space. So the superficial perineal space is everything between the perineal membrane and the superficial layer of perineal fascia. This is going to contain the muscles and erectile tissues related to the penis. Ischiocavernosus muscles here, bulbospongiosus muscle here, and we've got the superficial transverse perineal muscle as well. We'll just take it off for ease. Then, deep to those muscles, we've got the deep penile fascia. We'll just gradually work that off as well. Deep penile or Buck's fascia covers the erectile masses of the penis. In blue, the two, corpus cavernosum, making the crus of the penis, and the bulb of the penis, extending up towards the glands of the penis, is comprised of the corpus spongiosum. We take those erectile masses off, and we reach the perineal membrane. And the perineal membrane, if we were to turn it upside down and look on its deep side, we'd see another muscle, the deep transverse perineal muscle, along with a portion of it that's going to have a urethral sphincter associated with it. And one thing I neglected to mention, so we'll fill that in right now, is in the male there are two little glands hanging out in this layer called bulbourethral glands, and they're involved in lubricating the corpus spongiosum of the penis so that when ejaculation or urination happens, things move along relatively nicely. And these have their ducts emptying into the sphincter, the urethra, as it passes through the membrane right here and becomes the spongy urethra inside the corpus spongiosum. All right, that is it for male perineum and urogenital area. Losing our bulbourethral glands, not a good thing. We'll continue and look at how all these structures are represented to a slightly different degree or a slightly different way. Cross-section. What I've got here are the bones of the pelvis that make up the obturator foramen. So we've got the pubic bone, maybe a little bit of the ischial pubic ramus right here, and then the superior pubic ramus, maybe a little bit of the ilium rather, right here, and the obturator membrane between them. So what we're going to color in first is the muscle sitting on that membrane. That is the obturator internus muscle. Color it in red for muscle here. And the next landmark that we're going to show is going to be the major landmark that we had in both the male and female pelvis. We'll start right here by drawing in the perineal membrane in purple. So remember, the perineal membrane is the stout connective tissue structure that a lot of this stuff is anchored to. And for the moment, we're going to concentrate on the region right here. And in the male, this region allows the urethra to pass through, which is what we're showing right here. And we'll travel just a little bit up into the true pelvis until we reach the urinary bladder, which I'm going to draw in a little more bulb shaped than it really is, but that'll do the job right there. And here we'll fill in the wall of the bladder right there. And surrounding the bladder, we've got what's classically described as kind of a walnut-sized organ. Very important, prostate. So we'll color in a little prostate right there. And that gives us the urinary bladder, the prostatic urethra, what we're going to call the membranous urethra right here, because in the deep perineal space on the deep side of the perineal membrane, we've got muscle. And that muscle is the external urethral sphincter. Skeletal muscle, so it allows us to close down our urethra when we need to, and only urinate when it's socially acceptable. like to draw in here another muscle coming off the obturator internus, comes down and fuses with the fascia in here and a little bit with the fascia surrounding the external urethral sphincter. Do this on the left and the right. And that gives us the levator ani muscle, originating from a thick band of fascia along the obturator internus and inserting along the rectum, but more anteriorly here, wrapping around the urethra and all these other structures in the deep perineal space. Now what we've got right here in this area, this has been walled off by the perineal membrane, obturator internus, and levator ani, is the anterior recess of the ischio-anal fossa, which, as everyone I hope remembers, is full of fat. We'll color it in here in yellow for adipose. And let's scoot down to, before we do that, I'm going to draw in real quick, fold of perineum up here. So we've got the abdominal pelvic cavity up here, we've got the perineal lining right here, and the true pelvic contents right in there. If we went further posteriorly, we'd find the rectum and the sacrum. Now let's look at what we've got inferiorly. First off, we'll draw in big erectile tissue right on the midline here that wraps around the urethra. And that is the corpus spongiosum. Hence, this is the spongy urethra as it travels through the spongy body. Spongy body is just the translation of corpus spongiosum. And we'll draw in its buddies that make up the rest of the penis, the two corpus or corpora cavernosum. Alright, now remember these guys are surrounded by a layer of muscle. So we'll draw those in here. My apologies, got a little asymmetric there. But here, covering the corpus cavernosum, on each side we've got the ischio-cavernosus muscle. And covering the corpus spongiosum, we've got the bulbospongiosus muscle. Alright, now sometimes different text will say that you can find the bucks or the deep penile fascia between the spongy and cavernous bodies and then the muscles. Other sources don't show it until it gets out onto the shaft of the penis itself. Just be aware that if you have deep penile fascia in this area, it's going to be between the muscle and the erectile tissue. Then we're going to actually start on the outside real quick here and draw in the skin. Once again, blue for lack of offending anyone, unless you want to think about being Smurf anatomy or Star Trek anatomy. And then we'll draw in the next layer up is going to be our superficial perineal fascia. And then our deep perineal fascia wraps around the erectile bodies and their muscles. Connects back down to the perineal membrane if there's any gap there. Comes around and back to here. Now one thing I want to draw your attention to is the way I mentioned this before was commensurate with some of the atlases out there, in that we've got the skin, superficial perineal fascia, deep perineal fascia, perineal membrane. Other sources like Moore, Dowley, and Agour's clinically oriented anatomy call this the perineal fascia, and they refer to this as the membranous layer, and this is the investing layer. So you may see some variations in the nomenclature out there. Don't let it throw you. So according to Moore and Dowley, we'll just call this the perineal fascia. And we've got an investing and a membranous layer. Alright, now as usual, if there's any space in this area, we'll throw some fat in there. And a little bit of fat between the perineal fascia and the skin. And hopefully this makes things a little bit easier. From the perineal membrane down to this membranous perineal fascia, this is the superficial perineal space or pouch. And from the perineal membrane up to the inferior aspect of the levator ani and its fascia gives us the deep perineal pouch. Alright, so here we've got those structures. What I'd like to draw your attention to now is what's in each one of these pouches. In the deep pouch, we've got a portion of the urethra. In the male, we've got the prostatic and membranous urethra right here. We've got the external urethral sphincter. We've got the anterior recess of the ischial fossa. And in the male, one thing that we have, it's a little bit out of frame right here, so I'm just going to draw it in dotted. If we were to go further back, we'd find our deep transverse perineal muscle. So I'm drawing it in dashed here because it's not quite here. We'd have to go a little further posterior to the posterior edge of the UG diaphragm to find it. But that's where we'd find our deep transverse perineal muscle. And according to Mordaly and Agor, this is only present in males. In females, there's a smooth muscle bundle in the place of that instead. All right, so that's what we've got right there. And the male, one other thing to mention is we have those little glands kind of stuck into this area, not in the sphincter urethra, but very close. I'm just going to draw it right in there. We're going to have bulbo-urethral glands. All right, so that's the male. We're going to pick up and do the same thing with the female, but before we do, quick run through. Obturator internus muscle, levator ani, prostate, prostatic urethra, membranous urethra surrounded by the sphincter urethrae and perineal membrane. Bladder's up in here. What the heck, we'll draw the urethral, the ureteric orifices right there. You get a little trigone coming down to the urethra. Happy day. Then, out of frame, we've got the deep transverse perineal muscle posteriorly, the ischial fossas, anterior recess in yellow here, one on each side. In purple, the perineal membrane. Then, as the urethra goes through, enters the corpus spongiosum and becomes therefore the spongy urethra, surrounded by the corpus spongiosum, which is in turn surrounded by Buck's fascia, or deep penile fascia in the male, in some sources. Then we've got bulbospongiosus muscle, and on either side, corpus cavernosum, ischiocavernosus muscle, and likewise here, surrounded by deep perineal fascia, or alternatively known as investing perineal fascia, the investing layer of perineal fascia. Then some fat of variable degree between it and the membranous layer of perineal fascia, also sometimes known as the superficial perineal fascia. Then variable amount of subcutaneous fat and skin. Superficial perineal pouch is everything below the perineal membrane down to about that membranous fascia, and then deep perineal pouch is everything above the perineal membrane until we get to the levator ani, and then the true pelvic space above it. All right. Oh, and I should have gone in and done superficial pouches as well. So sorry about that. So a superficial pouch is going to contain the erectile tissues and their muscles, spongy urethra, superficial transverse perineal muscle would be out of plane of this area, but a little further posteriorly on the posterior aspect of the perineal membrane there. And the other thing that's in this area for both male and female are branches of the internal pudendal artery and vein, as well as the branches of the pudendal nerve. Sorry about the garbled right there. Now also in this area for males, there's not a whole lot of additional things that we find that are specific to males and not to females. But in the female, we'll see that there are a couple things in the superficial space that are particular. The big difference here is relatively obvious. I'll take the perineal membrane and slap that back on, is that instead of just a urethral opening, we now have a vaginal opening as well. And if I were to remove this, there would also be a corresponding vaginal opening in the levator ani. So we'll just draw that in right here, as well as a urethral opening present in both males and females. Now, if there's the perineal membrane, we're also going to have the deep transverse perineal muscles once again, and in this case, we flip this over, and the situation's a little more complex. We've got the deep transverse perineal muscle, and some sources say the whole thing is the deep transverse perineal muscle, but in our case, we'll refer to this part specifically as the deep transverse perineal muscle. And right here, we're going to have an external urethral sphincter. We're going to have a compressor vaginae. We also have these working together as the urethrovaginal sphincter, pulling each other closer together, and then these fibers going kind of obliquely up to the urethral sphincter are sometimes referred to as the compressor urethrae. So those are the basic groups of muscles that make up this area. They're all involved essentially in urinary continence for the urethra, or compression, contraction of the vagina. Now at this point we're going to flip this back over, and the female version of what's going on here is remarkably similar to the male with a couple exceptions. We slap back down this same muscle, the superficial transverse perineal muscle. There's a structure in both males and females that I didn't mention last time because it's going to be a little more important right here. I'm going to prop it right in the middle. This is a connective tissue structure, and actually embryologically marks the location of the urorectal septum that separates the urogenital and rectal regions from each other. But it's a connective tissue knot referred to as the perineal body. So the perineal body serves as an anchor for a lot of the muscles and other structures in this region, and it's very important in maintaining urinary and rectal continence, as well as sexual function with the musculature around the vagina. Now, let's take a quick look here at the same tissues in the same color. We've got the corpus cavernosum of the female, but instead of corpus cavernosum of the penis, this is corpus cavernosum of the clitoris. And clitoris, much like the penis, comes together from two crus to make the body, the head of the clitoris. But right here, it's obviously not as pendulous, it doesn't kind of hang out as far, and it tends to roll inferiorly, a little bit like this. Now in life, it's covered by a clitoral hood, and the head of the clitoris is visible underneath that. Corpus spongiosum, instead of a single bulb going out to the external genitalia, has to be split to accommodate the opening of the vagina and the urethra. So we'll put the corpus spongiosum right in there. Now this forms the vestibule, the common opening of the urinary and the genital tracts, and this region is sometimes referred to as the bulb of the vestibule. It can be felt, palpated in the labia minora, and one reason that might be something that a clinician has to do is that there are two little glands. This is actually quite a bit generous in terms of the size of these glands, but these are called greater vestibular glands because they're hanging out in the vestibule at the posterior extent of the corpus spongiosum, aka also known as the bulb of the vestibule, and these release their secretion into the vestibule, and they can sometimes become impacted and will have to be manually released, get the secretion out of there. And essentially that's the same structures put to a slightly different use in the female than the male. Male, everything sews shut and the urethra is enwrapped by the corpus spongiosum and exits at the glands of the penis at the external urethral opening. Females, the urethra opens after a much shorter course into the vestibule just anterior to the vagina. Alright, now I've taken the opportunity to cover the erectile masses of the clitoris with some aluminum foil, which is representing the deep clitoral fascia, corollary to the deep penile fascia, the buccal fascia, But we still have corpus cavernosum on either side, and corpus spongiosum, also known as the vestibular bulb, covered by that fascia. And just like in the penis, I'm going to very gently lay the skeletal muscles that cover these fascias. In the case of the corpus cavernosum, we've got 2 ischiocavernosus muscles, and unlike the male where we only had 1, we have 2 bulbospongiosus muscles. So ischiocavernosus muscles cover the corpus cavernosum, whereas the bulbospongiosus muscles cover the bulb of the vestibule and allow it to contract. Alright, now one quick clinical note here. As I've shown the perineal body, you can see the various muscles and structures in this area. During delivery, it's common for the birth canal to have to spread very widely, and one common surgical technique that's performed is the episiotomy. Now, there are a variety of episiotomies, but one of the commoner ones is a midline posterior incision, and I just wanted to make sure that I noted the perineal membrane is deep to here. Deep transverse perineal muscle is there, superficial transverse perineal muscle here, perineal body is located right here. All of these structures, let me push this muscle out of the way, are going to be affected and incised during a midline episiotomy, heading back towards the anal area. And in fact, if we were to draw in a slightly different view, we'd see the external anal sphincter itself has some connection to the perineal body up here and can become dysfunctional if that incision goes too far, or if there's ripping of the birth canal that goes back that extensively. Now, just like in the male, we're going to have spaces. All of these structures, their accompanying muscles, the greater vestibular gland, all in this area, and just like in the male, it's covered by fascia. In this case, deep perineal fascia covers this region, also known as Gaudelai's fascia, covers this with an opening for the urethra and the vagina. Just like elsewhere, we have then an area where some fat can be deposited. This is going to be the superficial perineal space, covered by the superficial perineal fascia, also known as Colles fascia. Tuck that out of the way so the clitoris is still visible. There we go. And no big surprise, just superficial to that fascia, we've got more variable amount of subcutaneous fat, and finally skin with the opening for the vestibule, urethra anteriorly and vagina posteriorly. Now in this case there would be skin and a small layer of fat making up the labia majora, and then deeper we'd have skin and a very little amount of subcutaneous fat making up the labia minora, which would encompass the bulbal urethral glands as well as the corpus spongiosum, the bulb of the vestibule.
Now let's look at the female perineal anatomy in cross-section.
Hi everybody, and we're back to look at cross-sectional anatomy of the perineum and pelvis, this time looking at the female. So I've already drawn in our ilium and pubis, our ischium and pubis, inferior ramus probably down here, and the obturator membrane spanning them, and the obturator internus muscle that is covering it on the inside. Just FYI, there's an obturator externus on the outside. We're just not drawing it in right now because it's not our main focus. So just like the male, we're going to draw in the next most important thing, which is the perineal membrane in purple. I'm going to leave a nice gap in it because several things have to puncture this membrane in the female. Not only the urethra, but also the vagina, both of which are going to empty into the vestibule. And we're going to draw this at the level of the vagina, a little compression there. So here, I'm going to draw in a little compression right there as it crosses the membrane. Vaginal opening, vestibule below, vagina traveling up, and running into the cervix. Now, normally I'd draw a nice little uterus up here, but because the uterus is flexed forward more often than not, anteroverted and anteroflexed, it's going to be a little bit out of the plane of section. So we'll draw this in here, draw a little opening towards the external os of the cervix, and we'll just leave that as representing the rest of the uterus and the adnexa in the female. I'm going to point out right here, so we've got the fornices, lateral fornices of the vagina. If we came forward, there'd be an anterior fornix and a posterior fornix past that, and right here we're looking at the external os, which is going to be the opening through the cervix to the vagina, between the vagina rather, and the uterus, which would be flexed up this way. Alright, so we've got vaginal wall leading to the vestibule, puncturing the perineal membrane. Of course, that's not all that's going on. We have, as you'd expect, the levator ani not only going around the rectum and anus as it comes through, but also attaching, looping around the vagina. We've got compressor muscles on either side, just like in the male, that the obturator muscle is connected to by way of the levator ani here. So we'll connect these guys back up that way. And this whole thing forms a sling around the internal genitalia of the female. So right here we've got the external urethral sphincter, which in the case of the female actually also wraps around, at least partially, the vagina. And we're going to have compressor urethrae, a little more lateral to that, coming in obliquely. And these are both in the deep space because they're on the deep side of the perineal membrane. And we'll draw in the muscle fibers of levator ani as well. And we've, no shock there, got our anterior recess of the ischial-anal fossa. The fatty fibers that are in there, or fatty tissue, adipose tissue that's in there. And we'll draw in the perineum that lines the abdominal pelvic cavity, sitting on top of the cervix and mostly the uterus. It's going to be a little bit below there. And one thing that's a little bit difficult for people to conceptualize sometimes, you can kind of color in here a little bit. From the lateral pelvic wall to the cervix, there's collagen fibers that contain the uterine vessels and the vaginal vessels. This is the lateral cervical ligament, also known as the cardinal ligament. So this is just one more way to look at that relatively confusing structure. So if that helps you, great. If not, maybe I'll get a video about that out here sometime. Drawing the cervical musculature right there. Good to go. Alright, now let's get back to the perineum itself. In the case of the female, as we mentioned before, the vagina and the urethra both empty into a vestibule. The vestibule is contained on either side by the labia minora. And actually, at this point, we're going to start drawing in with the skin, because the skin in here forms the labia majora, which reflects back onto the labia minora, so we'll get that colored in blue. And in the vestibule, as it goes to the vagina, we transition from the stratified squamous epithelium of skin to the stratified squamous but non-keratinized epithelium of the vagina. So we can't really demonstrate those tissue differences there, but there is a transition in epithelium as we move through from outside to in this area. Alright, so skin in blue right here. A little bit of a smear, sorry about that. Now just like the male, we're going to draw in our erectile masses. We've got, instead of a single corpus spongiosum, in the female we've got two corpus spongiosum on either side, also called the vestibular bulb. And as we'd expect, it's covered by muscle. Bulbospongiosis. And the clitoris itself is made up of the two erectile tissues on either side here, the corpus cavernosum. There's one. And the other, corpus cavernosum, in turn covered by ischiocavernosus muscle. So those are the major tissues. We've got in this area a few other fascia. So we'll color in the deep perineal fascia, also known as the investing layer of perineal fascia, covering the erectile tissues And in 3 dimensions, it would actually wrap around the vestibule anteriorly and posteriorly. But in this cross-section, we're just catching it somewhat discontinuously there. And then we've got the membranous or superficial perineal fascia out here, which kind of comes in, and it's a little unclear from the sources I've read what exactly happens to it in the area of the labia majora, labia minora. It may be a little bit deeper, but it does tend to stop to allow the vestibule to form right there. And as we'd expect, we've got subcutaneous fat superficial to the membranous layer of the perineal fascia. And within the superficial perineal pouch, we have more subcutaneous fat, not quite much of it in the labia minora. Right in there. Now, one structure that you're going to see in the female that you won't see in the male here is you've got the remnant of the gubernaculum, which descended or allowed the descent of the gonads in the male. The testes go all the way to the scrotum. In the female, the ovaries get caught by the uterus, and the gubernaculum remains as a small, wispy, collagenous structure in the superficial fat. This is going to be the round ligament of the uterus, which kind of just dwindles to consolidate with the collagenous fibers inside the subcutaneous fat right there. Alright, so let's review from outside to in real quick. We have the deep perineal space from the inferior aspect of levator ani down to the perineal membrane. So deep perineal pouch, and from the perineal membrane down to the membranous or superficial perineal fascia, we've got the superficial perineal pouch. Now, inside the deep pouch in the female, we are going to have, a little bit anterior to this, we'd have the urethra coming down. We're going to have the external urethral sphincter right there. Anterior recess of the ischianal fossa in yellow on either side. And one thing that's interesting in the female is that, unlike the male, where we have a deep transverse perineal muscle back here, in the female, according to Moore-Daly and Agur's Clinically Oriented Anatomy, 6th edition, there's actually a layer of smooth muscle on the posterior wall of the perineal membrane, and we'll draw that in here, a little shaded in because it's out of the exact frame we're in. It'd be at the posterior aspect of the perineal membrane. So we'll just say that there are smooth muscle bundles near the perineal body in the region of the, what we'd expect to see, the deep transverse perineal muscle. Alright, now in the superficial pouch in the female, we're seeing a lot of the same things we saw in the male, the erectile tissues and their muscles. We do have a superficial transverse perineal muscle, and that's going to be on the posterior aspect of the perineal membrane, but on the superficial side. And as with the male, branches of the pudendal nerve and the internal pudendal vessels, artery and vein. Now, one thing in the female that we have that we aren't showing here is going to be the greater, should have mentioned this up here, my bad. In the superficial space, we have the greater vestibular gland, particular to the female. And if we wanted to see that, we'd have to go to the posterior aspect of the corpus spongiosum, the vestibular bulb, and on its posterior aspect is where we'd see that gland, and I'll just kind of shade it in right there, even though it's not inside the corpus spongiosum. It gives you an idea about where its placement is thereafter. All right, hope that's been helpful.